Welcome to the first of our webinars in a series of webinars welcoming yourselves as internationally educated staff. I am Jill Coverdale and I am the Head of Education at the Royal College of Nursing, and I am delighted to be supported by a number of my colleagues from across the RCN who I will now ask to introduce themselves. So in no particular order, Comfort.
Hi everyone, my name is Comfort Ochefu and I work as a policy advisor within the RCN.
Gary
Cohen. I'm a national officer for the Royal College of Nursing and also a team leader covering independent health and social care sectors and the wider public sector. So that's everything that's not the NHS. Thanks.
And Jessie.
I'm Jessie Robinson. I'm a senior legal officer and solicitor based in our London office and primarily representing members in fitness to practice cases.
And Lindsay.
My name's Lindsay Meeks and I'm the regional director for the RCN in the West Midlands region, and it's our region that's hosting this webinar tonight. You're very welcome.
Thank you, Lindsay. Nikki.
Well, my name's Nikki Clarkson and I'm the professional lead for learning and development within the Southwest region.
So, as I said, welcome again. This is the first of our webinars and we're looking at what is the NMC register. And this evening we're going to be covering a few of the following. So it will cover what is the NMC, what are the requirements to be on the NMC register, including English language, health and character. We'll talk about the processes that we go through and the final steps to registration. We'll talk a little bit about adding your qualifications and going from being a nursing associate to a registered nurse, a different thing about what the RCN is and differences between the different countries. And then finally, the 5 reasons to join the RCN, and then an opportunity for you to ask questions of us. So if you have any questions throughout, please do put them in the Q&A and we will either try and answer them as we go through by we'll type in the responses for you so everybody can share, or we'll pick them up at the end. So please do put in any questions that you have. And I am now going to hand over to my colleague Nikki Clarkson, who's going to talk to you about what is the NMC Council, the National Midwifery Council.
Thank you. Thank you. So yes, it's what is the Nursing and Midwifery Council, and the NMC for short. And so the NMC is an independent regulator of more than 771,000 nurses and midwifery professionals in the UK. The NMC has an important role to play in upholding the highest professional standards in nursing and midwifery, whose vision it is to uphold safe, effective and kind nursing and midwifery practice, improving everyone's health and well-being. The NMC's core role is to regulate, and they do this by promoting high education and professional standards for nurses and midwives across the UK and for nursing associates in England. Its other role is to maintain the register of professionals eligible to practice and also investigating concerns about nurses or midwives and nursing associates, something which only affects a tiny minority of professionals each year. To regulate, the NMC ensure they support the profession by creating resources and guidance that are useful throughout the nurses, midwives and nursing associates' careers, helping them to deliver good standards in practice and addressing any new challenges along the way. By regulating and supporting our professions allows the NMC to influence the health and the social care sectors. The NMC works closely with the RCN. It discusses issues around workforce planning, safe staffing and a multitude of issues that affect nursing within the health and social care sector. By working with the NMC are able to use their voice to speak up for our members and to continue to strive for a healthy and inclusive working environment for our profession. So what are the requirements to register with the NMC? Well, there are various steps to join the NMC register as a nurse, a midwife or nursing associate. And the NMC has a step-by-step guide for those trained outside of the UK, and you will find all the information on their website as well. But the first part of the process is to check the eligibility of whether you can be placed on the register. And once your eligibility is confirmed, the NMC may ask you to complete a test of competence as well as completing your registration application. The test of competence assesses the skills and knowledge of nurses, midwives applying to join the register from overseas. But the test of competence is also used for those rejoining the register after a long period away from practice. Regulations passed by the UK government following the UK's departure from the EU, the European Union, allow for certain EU general nursing and midwifery qualifications to be recognised. So if you have a relevant European qualification that meets the requirements for automatic recognition, you wouldn't need to take the test of competence. And this also applies even if you're not an EU national, but you have a relevant European qualification. If you don't hold a relevant European qualification, you would need to take the test of competence as they will not recognise your qualification. Applicants must also provide to the RCN identity evidence like a passport details and a copy of your passport, and proof of qualifications, a copy of a qualification certificate and information on the education institution that you studied at. Your education institution must review the information about your qualification, confirm it matches their records, and confirm if it will allow you to register with the relevant professional regulator. If you previously registered in your country of training, the NMC will ask you for the name of your regulator and a copy of your registration certificate. The NMC will then contact your regulator, confirming your details and checking your eligibility criteria. And if you haven't registered in your country of training, the NMC will ask of a regulator that you could have registered with and contact them to check your eligibility. If any of your documents are not in English, then you must provide the original document, a complete and accurate English translation with a photocopy of the original document, also stamped and signed by the translation service, and the translation service contact details. Along with these documents, you will need to confirm a professional indemnity agreement, and you'll be asked also for the scope of practice and setting that you plan to work in once you've become registered. And just to go back to say, it's a legal requirement for everyone on the register to have an appropriate indemnity arrangement in place for when they practice in their professional capacity. In your application, the NMC will ask you to declare that you have or will have appropriate indemnity cover in place for whenever you practice. You don't personally need to hold your indemnity cover, but it's your responsibility to ensure that appropriate cover is in place. So it's worth checking with your employer or insurance provider to confirm this. You will also be subject to English language requirements and a health and character evidence, as well as being asked to supply the transcript. And now I'm going to hand over to my colleague Comfort.
When you apply to register with the NMC, they need to be satisfied that you have the necessary knowledge of English to communicate clearly and effectively in order to provide safe care. This requirement is the same for all applicants to the register. Now, there are different types of evidence that you can provide. You can either have achieved the required score in an English language test. So, for example, the IELTS, which is the International English Language Test System. And there's also the academic and the occupational English test. You will also need to have a qualification taught and examined in English, or recent practice of 1 year in a majority English speaking country. So there are a number of steps that you can take. You can confirm which evidence that you have. You can complete the English language test, supply training evidence, and also supporting information from an employer's form. If you have a health condition or a disability, you will need to declare it to the NMC by completing a self-declaration, by nominating someone to support your declaration, and also by ensuring that your nominated person has completed a health assessment in the last 6 months. Now, it's important for me to mention that although you do need to provide health evidence, declaring a health condition and/or a disability does not necessarily mean that you will not be able to join the register. But the NMC just needs to be sure that you have taken steps to manage your condition so that you are able to practice safely and effectively. Additionally, when you are nominating someone to make a supporting declaration, this can be your family doctor, it can be your general practitioner, it can be an occupational health practitioner, but not a family or a friend. You must also make sure that all of these things are completed. The next is character evidence. So to ensure that you can practice safely and effectively, the NMC requires evidence of your character. You will need to self-declare of your character. You would also need police clearance and DBS certificates, and you will also need supporting declaration from a nominated person. Now, the evidence required will vary depending on whether you are currently or have been registered in the last 3 years, if you have not been registered in the last 3 years, but you were previously, or if you have never held registration. In fact, one additional thing. Now, for those who have never held registration before, you will need evidence from your most recent employer if you have worked in a healthcare setting within the 3 years before submitting your application, your education institution that provided training if you've graduated but haven't practiced, or if an NMC registrant who has known you for at least a year and who you've been in contact with in the last 6 months before submitting your application. You could also provide another UK regulated healthcare professional who has known you for at least a year and who you've been in contact with. So all of these different ways are where you can get your evidence from to support your character. Now on to transcript. A transcript is an official copy of your academic record. Your transcript must be a personal transcript with your name on it. If you did not train in a country where English is a majority spoken language, your transcript must confirm that the programme was composed of at least 50% clinical interaction. It must also demonstrate that at least 75% of this was with patients, service users, their families, and other healthcare professionals. And this must have taken place in English. Now, a transcript must be supplied to the NMC as it's an official copy of your academic record. Now, you should also make sure that you do not just provide a generic course syllabus, but it has to be personal with your name on it. And if you did not receive a transcript when you graduated, please contact your training institution to request a copy. Next slide, and pass it on to one of my colleagues.
Okay, so how much will the process cost and how long will it take? When you're ready to submit your application, you'll need to pay the £150 registration fee, and you won't be able to submit your application until you've done so. The fee will be refunded if you withdraw your application before the NMC can complete your registration, or the NMC close your application because you didn't return the required supporting evidence within the timescales given, or your application is unsuccessful because the NMC determine that you don't meet the registration requirements. You should review your application to make sure all the details are correct to avoid any delays. And it's important to take time to prepare because there's numerous factors to take into account, including preparing the evidence you need to show you meet the registration requirements and how much preparation time you feel you need before you take your competent computer-based test or the objective structured clinical examination, so the CBT and the OSCE examination for short. The NMC aim to assess your qualification within 14 days, and then once the NMC have confirmed your eligibility to apply for registration, you'll have 2 years to complete your registration, and this includes taking any tests. So final steps to registration. So once you've submitted your application and paid your registration fee, the NMC will contact your nominated referees to verify your qualifications. The NMC can only evaluate your information once they've received all your supporting information and verification from your referees. The NMC may need to ask you more information if any of the details you provide are unclear or appear incomplete, or if your referees provide conflicting information. On receiving all your supporting information, your supporting health and character and language evidence, and where applicable, your CBT and OSCE results and your registration fee, the NMC will aim to assess your application within 30 days and will then contact you by email to let you know the decision and your next steps. The NMC are required to make a decision on your application within 3 months of receiving your completed application, and if they fail to do this, you do have a right to appeal. And just to give you a quick important tip as well, our suggestion is contact your referees before you begin these processes, because when you're ready to submit your application, make sure that you let your referees know that the NMC will be contacting them to provide your supporting declarations so they can respond as soon as possible. That's next slide, please. Thank you.
Okay, wonderful. So we've covered registration now. So now we're moving on to how you maintain your registration with the NMC. And the process for doing that is called revalidation. So you need to undertake revalidation with the NMC every 3 years. And the 7 requirements of revalidation are outlined here for you. So the first is practice hours. So you're expected to evidence that you have practiced for a minimum of 450 hours over a 3-year period. The second requirement relates to continuing professional development. So here you are expected to undertake 35 hours of CPD relevant to your practice. 20 of these hours should be participatory. And you would need to evidence this CPD by keeping a record, which might include a description of the topic, how it relates to your practice, when the CPD took place, how long it took, and what part of the NMC code it related to. The next requirement is practice-related feedback. So this is that for this you're required to have 5 pieces of evidence related to your practice. And the next requirement is a reflective account and reflective discussion. So here you should have, again, 5 reflective accounts over the course of 3 years. And these can be focused on your CPD feedback or an account of a particular experience or event that you have encountered. All reflections, again, must relate to the code of conduct. And you must also organise a reflective discussion with another registrant to discuss the 5 reflective pieces that you have put together. The next requirement relates to health and character. So similar to what we have discussed in relation to registration, you need to provide a declaration that you've not been convicted of any criminal offences and declare any fitness to practice issues with your health or your ability to practice in general. You must also ensure that you have the necessary professional indemnity arrangements. As we discussed in relation to registration, this is something you can confirm with your employer, as they more often than not will be covering you for this, but you need to be sure that that's the case. And it just ensures that if someone has suffered harm through any actions in which you were involved, they can claim compensation. And then the final requirement is confirmation. And here you must meet with a person who confirms that you have met all of the above requirements. Usually that would be your line manager, but they don't, strictly speaking, have to be a registered nurse, and there could be another healthcare professional. Okay, so what happens if you lapse from the NMC register? In this case, you would need to apply for readmission, which can take around 6 weeks for the NMC to process. The requirements of this are that you must, to be eligible for readmission, you must have undertaken either 450 hours practice in the previous 3 years or 750 hours practice in the previous 5 years. Again, as with the revalidation requirements, there are some similar requirements of readmission. You would need to have 35 hours of CPD, you would need to hold appropriate indemnity cover and make the health and character declaration. In addition, the NMC will assess your application to determine whether you meet the English language requirements, and you would need references from three different people. Obviously, this is a huge amount of information. If you were ever to go through this process, that the specifics are all outlined on the NMC website. So we would help guide you through that if you did have any questions as and when you encountered the process. Okay, I think I'm back over to Jill.
Thank you. So adding qualifications once you're on the register. So once you're on the register, you can apply to add another qualification to your existing registration. And to add a qualification, you need to have an NMC online account. You need to have an NMC online account to revalidate, so you'll probably have that anyway. You'll need to provide the qualifications and registration detail. If you've also registered as an adult nurse, you could add a children's nursing qualification, for example, but you cannot add clinical specialisms like cancer nursing or critical care nursing. You will also have to complete the test of competence to show you have the relevant knowledge and skills for that qualification that you wish to register. Each test of competence is split into 2 parts. A multiple choice computer-based test known as the CBT, which has already been mentioned, and a practical test like the OSCE, as we've already mentioned. You will need to take a test that's specific to the part of the register that you're applying to rejoin or join. And these are in the UK, the adult nurse, the mental health nurse, learning disabilities nurse, a children's nurse, a midwife, or a nursing associate. And how long is that valid for? You must pass the CBT and the OSCE within 2 years of each other. You can sit your CBT or your OSCE in any order, but you need to complete both parts to continue with your application for initial registration or readmission. And once you have successfully passed both the CBT and the OSCE, your test of competence will remain valid for 5 years. There is a cost to the process, and it can be over £1,000 in costs. Transitioning from a nursing associate to a registered nurse. So nursing associate is a relatively new role within the team. Nursing associates, or NAs, work with healthcare support workers and registered nurses to deliver care for patients, and for some NAs it's a stepping stone to registered nursing. You can put your nursing associate qualification towards a shortened degree programme or a registered degree apprenticeship programme into registered nurse. It's normally about 2 years and consists of clinical placement and some additional theory at a university. The NA role is at an academic level 5, whereas the study towards a nursing degree is at level 6. By taking into consideration all the learning you've completed as a nursing associate, it shortens the time you need to study to become a registered nurse. And to be eligible, you must have a visa. You must have completed a foundation degree in nursing associate and evidence of that. And you must also have a GCSE maths and English. You may apply to the NMC register. You may apply to the NMC to register as a nursing associate if you trained outside England. The NMC website sets out the requirements and gives an overview of the application process, so you know what to expect along the way. Next slide, please, and over to my colleague Gary.
So, yeah, hi. The independent sector is shorthand for the independent health and social care sectors that operate across the UK. Now, there are so many different places to work outside of the NHS as we talk now. So obviously social care is probably the biggest employer outside the of the NHS of nursing staff, with probably a workforce across the whole of England of over 1 million. But there are a multitude of other places that you can work. As I said, from looking at that, the list I've put there, it could be anywhere from the hospices such as Marie Curie through to the large acute chains such as Circle, Spire and Nuffield. And what people don't often realise is that GP nurses, even though the GP is contracted to the NHS, they aren't actually working directly for the NHS. So GP practice nurses, again, a big significant workforce, are employed outside of the NHS but contracted to provide a service. Criminal justice systems, prison nursing, whether it's provided by the prison service itself or a third party provider. Occupational health, local authorities in England specifically provide health visiting, school nursing and community and domiciliary care services and fund those. And health protection teams work across the UK Health Security Agency, where members there working predominantly initially has been around developing vaccines around the COVID pandemic outbreak and looking out for endemic and pandemic outbreaks across the UK. So there's a multitude of different areas to work in. So when you see independent sector, it actually means all of that and anything in between. The RCN is a trade union, and this is kind of a textbook definition of what it is. It's established to actually provide assistance, representation and services for its members, i.e. those who join it, for better pay, terms and conditions and a better working environment. And that includes good health and safety, a good learning environment to develop in the nursing workforce, but also enjoy better pay, terms and conditions. So in the UK, there's about 7 million people who are union members. So makes the RCN quite a large union in UK's perspectives. I think we can still quote that, can't we? The largest nursing trade union professional body in the world. So it is big. So it is a big organisation to join. However, it wouldn't work without RCN activists, reps. Those are members who take on roles such as health and safety reps, stewards, learning reps, board and branch chairs, who actually make the RCN work at the workplace and actually are the connection back to those members. They are ably supported across the country by RCN regional offices, nursing department, education, policy. So there's a whole set of functions that knit together to make the trade union what it is. As a trade union in the NHS, the RCN sits on the NHS Staff Council Executive and is one of the lead trade unions in the NHS. So it's a significant role, and it's really about making sure members' pay terms and conditions are as good as they can be, and if members get into difficulty at work, the RCN is there to help and assist them, whether it's for our RCN direct or the regional offices to support them. So that's what a trade union is. Well, we take these things for granted. Well, I think a lot of the workforce do in the UK. Paid holidays, all of these issues and benefits that we currently enjoy were negotiated or fought for by trade unions. They're not gifts of an employer. They've been negotiated over 60, 70 years. If we go back to the 40s and 50s, that's 20th century, 6-day working week was the norm in the UK. It's not now. We're now even talking about a 4-day working week, moving to that as a norm. Equal pay for work of equal value. Again, that's a trade union issue that was looked at the differences in pay between men and women, and historically men have been paid more than women. So arising out of a number of court cases and changes to law led by unions, we have equal pay enshrined within the Equality Act 2010 in the UK. So trade unions have accomplished a lot. In 150 years they've been in existence in the UK, and the RCN as a trade union professional body, as it says there, it's about looking after a member so they can deliver the best patient and client care possible, and having a well-educated, well-paid, well-looked after, working in a safe environment creates a good area and a good arena for good patient and client care. We're just going to touch on this briefly. In the UK, there are 4 countries and all of them have got devolved outside of England. Scotland, Wales, Northern Ireland have devolved powers in the way they organise health. So there are some differences there. I mean, in the NHS, it's the NHS pay terms and conditions framework is there for all 4 countries, but there are variations in some of those terms and conditions. And England probably has got the largest number of employers that are not in the NHS, but outside that, all those areas are operated and organised slightly differently because of those devolved powers that those 3 other countries got. So it'd be worth checking on any of those links for any particular questions you might have or thoughts you might have about working in different countries in the UK outside of England. Thank you. And next slide, please. And I'll hand over to Lindsay.
Yeah, thanks, Gary. So just before I start on 5 reasons why you should join the Royal College of Nursing, just a reminder to start putting your questions and in the chat, just so we can move to that once I've finished this slide. So for those colleagues on the call, some of you may already have joined us, and some of you might be contemplating joining us. As Gary referenced, we're growing all the time, which is quite unique for a trade union. But what's unique about us also is that we're also a professional body. As Gary referenced, we are the world's largest nursing union and professional body. And by joining the RCN, because of its twin functions of trade union and professional body, you'll benefit both personally but also professionally. And we're here to help both with your difficulties but also your development. So just moving on to those 5 reasons. The first of all is that professional development, being part of a professional body. We're committed to lifelong learning and the development of our members. By becoming a member, you'll have access to RCN Learns, nursing, health and social care learning resources. And we also have Europe's largest nursing library. If you're doing any further education, master's, PhD, you'll want to join us. And then we also have our forums and our networks all here to support you. As part of that, also workplace support. We are the only nursing specific trade union in the United Kingdom, and we can provide you with specialist workplace support and guidance from our extensive team of both officers and also representatives, stewards, etc. Across the UK, and that covers everything from workplace employment issues to the NMC referrals. Just moving on down, then legal advice. We do have an in-house legal team, so if you get referred to the NMC, you'll be represented by a solicitor in-house, and that again is quite unique within a trade union, and you'll receive comprehensive support and information. Member support wise, huge array of resources, both within the regions and countries, but also through our member support services. So we can provide emotional and practical support with immigration advice. We have an in-house immigration team. There's welfare guidance support, your financial well-being, and obviously we've been doing a huge piece of work on cost of living as well. Career-wise, we have a dedicated careers resource. You can explore the next step in your career with our telephone career coaching, and there's also tailored online resources to help with CV preparation, preparing for interviews, and career ideas and inspiration. Telephone counselling for those members who are having a difficult time. That's available, as well as peer support for our members with disabilities. And then there's also a handy guide that we've just released in terms of to common English expressions. We are unique in that, so that's also something that we just released. It's not on here, but we have member discounts, so you can actually recoup the cost of your membership with discounts at over 3,000 retailers, get cheap cinema tickets, enjoy preferential rates and deals in insurance, will writing and financial advice. And then the last thing is the careers advice, so a very extensive careers resource with helpful guidance on career planning. So in short, you're not alone. You can join over 500,000 nursing members. We're nursing specific, nurses for nursing. We are the voice of nursing, and we'd urge you to join us to be part of the world's largest nursing trade union and professional body. Newly qualified nurses, or those that just in the first year of joining the NMC, the NMC, if you join us, that's £8.20 for the first year, and then it moves up to being £16.40. But what I would point out is that you can claim tax relief on that, so that £8.20 actually becomes £6.56 a month, and that £16.40 becomes £13.12. So all in all, excellent value. So this means we can now move on to our Q's and A's. So we'll just have a quick look in the chat. So the first question is, it says an internationally educated RN from Europe are not required to complete the CBT or OSCE as discussed. Are they expected to complete an English exam if English is not their first language? Who'd like to take that question? Jill, is that one you could take?
Yes, absolutely. If English isn't your first language, you will need to take an English language test, yes.
Lovely. Next one is, do registered nurses from North America, will they be expected to complete CBT and the OSCE exam?
Yes, they will need to complete the CBT and OSCE exam. As it's an English speaking language, they wouldn't need to complete the IELTS, but they will need to complete the CBT and OSCE exam.
Okay, thank you. That makes sense. What are the current guidelines about NMC re OET not required if UK employer signs off?
I think what we need to do is we need to get some a response from the NMC on that, and then we'll put that information into the chat following the video, the recording.
Okay, thank you.
I'm sorry, so that.
So in North America, the NCLEX exam is done if you wish to be registered to practice in the country. Why does the UK also have an OSCE? What is the history behind it, and is it still fit for purpose? For example, the fluid balance chart used in the I think she means the OSCE, or they mean the OSCE, is different to the one used in my trust. Who'd like to take that question? So essentially what the colleague is saying is that in North America, the NCLEX exam, what's the NCLEX exam? Sorry, I don't know what these acronyms are. I presume that's their equivalent test, is it?
Yeah, it's their equivalent test.
Yeah.
So they're saying it's done if you wish to be registered to practice in the country. Why did we have an OSCE? What is the history behind the OSCE, and is it still fit for purpose? That's one question. And the participant referenced the fact that the fluid balance chart used in the OSCE is different to the one used in their trust. Who'd like to take that question? Essentially asking what's the history behind the OSCE, and is it still fit for purpose?
Yeah. The NMC have been doing quite a bit of work recently looking at making the system and process for internationally educated nurses much more efficient and streamlined. And all of these processes have been looked at very carefully. There's been an evaluation of the process too. So it is looked at, and it's looked at on a regular basis. And this is all about ensuring that practitioners who are coming into the country are fit for purpose, fit for practice, and patients are receiving safe care. So through those evaluations, the decision has been made that this is still the right thing to do in terms of ensuring that people coming to join the register are fit to join the register. So yes, it is. And you'll find that perhaps there are different fluid balance charts across the UK, but they'll all principally be the same. They'll have the same safe principles.
Thanks, Jill. This is a similar question. Has any research been done on the psychological impact of the OSCE on the internationally educated registered nurse?
And I think that does follow on from what I was saying, that evaluation has been undertaken utilising those internationally educated nurses who've already gone through the system. So they are key stakeholders who the evaluation has been, and that's why in 2019 the NMC made an announcement that they would be looking and doing this piece of evaluation to ensure that they were as efficient as possible and that processes are streamlined, because they're very aware of the impact on international nurses when they are applying to join the register. And any of my colleagues, please do add anything in if you wish to do so.
There was
Thanks,
a little
Jill.
element, apologies, there was a little element about the history of the OSCE. Just for some extra information, the OSCE was first created in 1975 as an alternative to existing methods of assessing clinical performance. And it was designed to improve validity and reliability of assessment of performance. It was originally for medical practitioners, but it's now been expanded to other practitioners such as nurses.
Thank you, Comfort. And it's worth saying that for anybody who's undertaking either a specialist practice qualification in the UK or an advanced nursing practice qualification or a consultant nurse qualification, all of those things include OSCEs. So they are a way of assessing people's skills and confidence and competence in that setting in terms of delivering care. So it's not just about international nurses undertaking those. These are part and parcel of other qualifications that any registered nurse in the UK has to undertake if they want to have additional qualifications to their original qualification.
Thanks, Jill. We've got a couple more questions that have just gone into the chat. I think we covered what is the NMC's latest guidelines on OAT. There was a similar question a little bit further up the thread. So we've got this one now. If you have a degree in your home country, how can you update to a master's, and how many years to complete the master's programme? Who'd like to take that one? Is that you, Nicola? No.
No, it's more Jill. I'm so sorry.
More Jill. Okay, sorry.
No,
thanks, Jill.
That's fine. That's fine. It depends on the master's degree programme you're looking at joining or undertaking. And my advice to you is to look at the different universities, because they'll have what we call different approaches to APEL, the accreditation of prior experience and learning. So it is a really good idea to have that discussion with your local university. or Open University. People may be familiar with Open University, which is traditionally a online learning programme, although now other universities have got that facility. So it does depend on what you want to do, and also depends on whether you can do it full time or whether you want to do it part time. So if you, for instance, if you were going to do a master's degree in, my master's degree is a master in public health, and that was 2 years part time from my first qualification. So that it does depend on which one you're doing, but I would say think about 2 years as an average.
Thanks, Jill. This one probably is quite similar, again about APAL. So this colleague's an overseas trained nurse, trained in the United Arab Emirates and working for the NHS for a while as a registered nurse. She has a qualification with a high diploma in nursing and wants to study for her degree in nursing. So what is the route for that?
Yeah,
thank you.
It's look, a question that we're often asked, and once again, not just from our internationally educated nurses, but from our own nurses here in the UK. We only had the degree programme from 2010, so we have a large number of our registrants who don't have a degree in nursing. We have a diploma in nursing or a higher diploma. There aren't as many programmes as we would like for people to top up to degree, but most universities will allow you to apply to do a master's degree rather than having to jump through the hoop of a first degree first. So once again, take your record of your learning, your portfolio of learning, and discuss with your local university how you might start a master's degree rather than having to go through the first degree as well, as you've got a lot of APEL that would probably show you could manage on that PG dip and PG cert level. We run 3 particular modules that we have now got accredited with a university, and they are at level 7, so we're not requiring you to have a first degree to undertake that. We will absolutely look at a portfolio and your APEL first, so please do get in touch.
Okay, we've got a great question here, and this colleague wants to know, what is the RCN doing to have a strong presence and representation among the international nurses working in the care homes, as their experience is quite different from their counterparts working in NHS regarding professional support in their practice? Gary, did you want to take this one, or?
I'm happy to kick it off. I mean, social care it's the second biggest employer outside the NHS of nursing staff. It is a challenge because in England alone, you've got 19,000 different employers. So we have got rep networks. They're not as big and developed as they are in the NHS. And we have got particular relationships with some of those big employers in social care. But it is really challenging because of the number of employers. They can range from anything to an employer that's got 1 or 2 care homes through to a chain that covers 400 across the whole of the UK. So it's such a diverse area, but we do cover it, and we do have representation and recognition arrangements with a number of those big ones. But it is something that we're striving. We've got to do more at. But as I said, the challenge is the sheer volume and different numbers of employers that are out there.
So I'm also happy to come in here. I mean, the RCN recognises about our need to spread our presence and our representation amongst the independent sector. So we've made an investment in the last year of over £1 million, and each region and country now has an independent health and social care lead nurse working within either the region or the country in order to, as Gary says, try and get out there. It's a bit like finding a needle in a haystack because of the multitude of employers, but they're already building a strong presence, and that can only build as they build up their job roles, etc. So yes, that certainly is an investment the RCNs has made in the last year. So I've discussed our processes with some of our colleagues, and they state that that prior to the OSCE being introduced, they've completed a comprehensive induction programme. Will this ever be considered again? Personally, I found the exam one, which it was about completing each stage in a specific period of time and just hitting key boxes. I understand as a medical student, nurse or a doctor moving to a higher grade having to perform this exam, but this is how I feel. So I think it's further feedback on the OSCE, and that it's not really hitting the spot. Was there any further comment wanted around that, the unhappiness that's been expressed? Anybody want to come in?
I don't think there's anything more to say. As I say, it has been evaluated recently, and will probably feature in the regulatory reform work that will be undertaken by the NMC. So may well be, you know, things are always being looked at from time to time.
Okay, thank you very much. So thank you to all my colleagues on the webinar tonight. As I say, we hope that you found this useful, and the evaluation is there in the chat. And if you've got any feedback at all about either this presentation or what you'd like to see in the future, then do please let us know. Okay, thanks everybody.